effort to contain the spread of the coronavirus, China's vice premier on Thursday ordered Wuhan city officials to screen each resident's body temperature by visiting every home. But experts are concerned. If the coronavirus from an infected person lands on the protective suits, workers might accidentally spread to other households. Many people have expressed concern online. One of them wrote online his family hasn't left their home since January 23rd and they're all healthy. He worries with the new mandate his family might get infected. Masks are also in short supply and residents have come up with clever ways to make their own. Many think the face mask doesn't offer enough protection and have turned to wearing large plastic bottles over their heads. Another has transformed a grapefruit into a mask, but is it effective? While another person has turned 3 water bottles into a mask that almost resembles an astronaut. As more and more cities inside China are put on lockdown due to the coronavirus outbreak, people are wondering if Beijing could turn into an epidemic site. The magazine China Science News published a study on cities most at risk. The top 5 cities are Beijing, Wuhan, Guangzhou, Chongqing, and Shanghai. The ranking was based on the spread of the coronavirus, as well as other factors like climate and population. So, where does the coronavirus originate? Chinese authorities said it came from bats. They said the virus then jumps from the bats to primates and then infects humans. But experts are wondering how this step is achieved. Some experts have pointed out a P4 lab in Wuhan as a likely place for such a step to take place. A P4 lab handles level 4 biosafety pathogens, the highest level and most dangerous, which have high fatality rates and no known treatments, such as the Ebola and SARS viruses. This P4 lab in the Wuhan Institute of Virology is only 20 miles away from the seafood market, where the coronavirus reportedly first broke out. A Chinese scholar recently challenged this lab to explain how the proteins of the coronavirus seem to have been precisely engineered to enable the virus to bind onto human cells. He also disclosed unethical and unprofessional practices he previously observed in China's bioresearch labs. The lab's deputy director released a statement on February 2nd denying the accusations but offering no explanation. The White House on Thursday asked U.S. scientists and medical researchers to rapidly look into the origins of the virus. They want to address the current spread, prepare better for future outbreaks, and understand more about animal, human, and environmental transmission aspects about the coronavirus.
Thousands of miles from Wuhan, but the coronavirus has now reached this picturesque ski resort high in the French Alps. Proof this is no longer just China's problem. 5 Britons, one of them a child, have tested positive. They were on holiday in a chalet in the town of Les Contamines-Montjoie. They've been in close contact with another Briton. It's thought that man contracted the virus on a 3-day visit to Singapore last month. He then flew to the French Alps for a few days before returning to the UK. He's thought to be the first Briton to contract the disease and is now being treated in a London hospital.
The positive cases and the contacts this British national had with others, 11 British people in total, were all staying in the same chalet and were hospitalised during the night in 3 hospitals. They're not in a serious condition.
Another Briton, Alan Steele, has tested positive while on honeymoon with his wife on board the Diamond Princess cruise liner. He's now in hospital in Japan. His wife is still on board the ship.
Alan's good. Like I say, Japanese doctors are looking after him really, really well. His health is fine. Honest to God, he's fitter than most people. We only have coughs due to the aircon.
64 passengers have tested positive and are now in hospital. The rest, more than 3,500, are confined to their cabins. A British passenger filmed on deck when he and his wife were allowed out for a walk. He says that only happens once every 4 days.
I know this sounds really strange, but the thing that we both noticed is that our legs were aching because we haven't had that level of exercise. We haven't been able to walk anywhere at a distance, being confined to the cabin.
In Mallorca, another British family is in a hospital isolation ward awaiting the results of tests for the virus. The Chinese authorities are still keen to promote an image of order. This is one of the new hospitals built in a matter of days. Patients with masks are calmly accompanied in for treatment, but 86 people died in the last 24 hours, according to official figures, the largest number in one day. The death toll now at 723, according to the World Health Organization. And on social media, the authorities seem anything but calm. I don't have money to buy a mask, this woman tells police officers as she's arrested. Others are dragged from their homes. 150 Britons are due to be flown home from Wuhan overnight. They'll then be kept in quarantine for 2 weeks in Milton Keynes. Only 3 people have tested positive in the UK, and the World Health Organization says the spread of the disease remains slow outside China.
Jane Dodge reporting. Well, earlier I spoke to Professor Trudy Lang, Director of the Global Health Network at Oxford University. I started by asking her if she was concerned about the new infections in France.
It does and it doesn't. I think we would have expected to see this sort of transmission, and it is showing that we are seeing person-to-person transmission beyond those people immediately coming from the centre of the infection in China, but not to any sort of huge numbers. And I suppose the good thing is, look how quickly it's been tracked. You know, he was diagnosed in the last few days, and then they found these cases in France.
Does it surprise you that there's such a vast discrepancy between the number of infections in China itself, I mean, over 32,000 cases, and then the very small number comparatively in the rest of the world? Is that unusual?
Well, everything's unusual because it's a new virus, and so we're all watching and seeing how it unfolds. I think that, you know, the numbers in China are carrying on at the same rate so far, with the same level of mortality, but we haven't seen such rapid transmission outside of China so far, which is very reassuring.
Do you think that we're overreacting then? I mean, or that the Chinese are overreacting, you know, shutting down entire cities, you know, the entire economy's gone into lockdown at the moment. You know, we're banning, you know, certain flights coming in from China. Royal Caribbean Cruises has, you know, stopped anyone with a Chinese passport or a Hong Kong passport from getting on one of their ships. Should we be more afraid of the overreaction than of the virus itself?
China is being incredibly responsible. The whole aim is to halt transmission and isolate infected people and stop that person-to-person transmission. And so the really difficult line to tread is how far you go with you know, shutting schools, stopping travel, and I think the response in China is proportionate, and then in other places of the world it has to be proportionate to the number of cases. You know, here in the UK, the risk for the individual is still reported to be low, because it is, and so the reaction needs to be proportionate, and take that really difficult line between you know, really stopping transmission as effectively as possible by limiting people being near each other, versus the economic impact of an overreaction. So it's a very difficult call to make.
And in terms of, you know, comparing that to the general, you know, the annual flu, I mean, I think last year 13,800 people died in the United States of the flu. So again, you know, comparing the numbers today of the novel coronavirus to the regular flu numbers, you know, we're nowhere near that kind of seriousness in terms of the number of fatalities.
The number of cases they're reporting are actual diagnosed cases, so there's probably a far higher number, which would bring the mortality rate down even further, under 2%, which gets much nearer the normal seasonal flu, which will go through a population. And I think so that's a really, really responsible and sensible comparison to make.
On that note, Professor Trudy Lang, thanks very much.
A shrine to Dr. Li Wenliang outside the hospital where he died, a martyr to telling the truth. He was one of 8 medical officials who reported the outbreak at the start and was reprimanded by the Wuhan police for spreading rumours. In Hong Kong, they understand the relationship between secrecy and the spread of the novel coronavirus, which has entered the territory from mainland China.
He's the first group of people who has discovered this disease, and he's willing to speak up the truth. And luckily, the truth was not the spread around early. So that's why things happen like this.
The way they do things is secretive, and this is the result. This is the difference between a society with democracy and one without.
As news of his death spread, millions of Chinese posted their anger and grief on social media, with memes about how he'd been gagged. The people's hero, a whistleblower. Others saying Chinese people wake up with the hashtag We Demand Freedom of Speech. But as soon as the posts go up, they're pulled down. This content no longer exists, it says. His mother spoke to Chinese media. At a press conference in Beijing this morning, health officials expressed condolences.
李文亮医生在抗击疫情中
trying to co-opt Dr. Li's hero status and reduce popular anger. They'd much rather talk about how they've nearly finished building a second 1,000-bed hospital in Wuhan at record speed. That's the advantage of an authoritarian regime. You can get things done. But the image of an efficient, modern healthcare system is at odds with what Wuhan citizens have filmed. Patients are packed like sardines in a new quarantine center in Wuhan. Medicines are in short supply, and they say basic hygiene isn't observed. The potential for further rapid spread is obvious. In Chinese cities, people are blowing whistles in honor of the whistleblower Dr. Li Wenliang, and isolated in their apartments in Wuhan, shouting in his support. They've been posting the lyrics from the Les Miserables anthem, Do You Hear the People Sing? It's not clear that Chinese officials do.
Well, Thailand now has 25 confirmed cases of the coronavirus, and its capital, Bangkok, is now considered the most at-risk city in the world outside of China for spread of the infection. Our Bangkok correspondent, Jonathan Miller, has spoken to doctors and officials tasked with tackling the virus, who admit they may only be able to delay its spread rather than contain it.
The land of smiles has gone incognito. Bangkok, city of angels, now the city of masks. At Erawan Shrine, they pray for good fortune. In uncertain times, with so many unknowns, there is just hope and prayers. Coronavirus, the unwelcome visitor, has caused quiet panic. Quality masks have long since sold out, as has hand sanitizer. Behind the masks, sometimes you sense fear in those eyes. Thailand's public health minister, Anutin Cheerwirakul, was handing out flimsy surgical masks this morning. He had a go at Western tourists for refusing to wear them. Unbelievable, he said. We should kick them out of the country. I paid him a visit at his public health ministry.
Good morning, Minister. Very good, thank you, sir. Do you feel everything's under control?
Well, we have to take precaution. We don't feel comfortable. We feel confident with our system. I'm confident with our doctors. I'm confident with our people.
Do you believe it can be contained before it becomes an outbreak?
We have done our best, and so far so good, isn't it?
At the heart of his ministry, the War Room, as it's called, a 24/7 coronavirus command center. Thailand, site of the first human-to-human transmission outside China. Bangkok ranked the city most at risk in the world due to its profusion of air links with China. Chinese tourists, 10 million a year, lifeblood of the industry here. Their numbers have now plunged.